computer. And then I'm gonna make you co-host in case for whatever reason I don't know, drop off. But okay, perfect. So we're gonna get started, and the way I'm gonna do this is I'd like to start up with introductions, but first of all, to everyone who is on here, good morning, good afternoon, good evening, wherever you are. We have this set up as a webinar. We have the people on the stage who are the POHER scholars. These are medical students from various African countries, and they will introduce themselves to Mr. Ford. And then in the audience, we have attendees. Some I may know, some I don't know. We're recording this. We were going to live stream it, but for whatever reason, that part is not working, which is not a big deal because I will post this link for everyone. I just want to first of all just say a big, big thank you to Doug. So we're classmates. So we're in the bioethics course together. And this year, we've spent the most time together, I would say, because we're in the same capstone group. So in our second year, they put us in like smaller groups, and I think there's 7 of us out of however many from a larger class. And so we see each other, every week for class. And I've known him, we've interacted, but and I remember one time in class, the instructor, congratulated him on being like a Forbes 30, and we are all so excited. And then I saw a post on LinkedIn, and I was just like, oh, wow, I actually did not know this much about him, even though we interact and we talk, and I always find his comments insightful during the capstone because we have to speak to each other. And so when I read his story, I was just extra moved. I already knew who he was, but it was just very, very touching just to kind of read about what he had been through. And I thought about it and I, asked obviously for permission just to make sure he would be okay with coming on here. It was on LinkedIn, so I thought it would be okay. And what I'm hoping everyone gets from this, for me, the key things that came out was just sort of his personal story, healthcare, innovation, what he did with that experience. How do you move it from just a personal experience into something innovative, into something that's entrepreneurial? And what I said in our meetings, I think yesterday or whatever, I'm like, some of these things aren't things they teach us in med school. So when you meet people who have this knowledge, who have this experience, I think it's best to just sort of grab them when you can and see what you can learn from them. So what I'm hoping is that you guys, whether it's, those in the audience, those on the panel, feel free, he's going to present, but you guys should feel free to ask him whatever questions and he'll answer with whatever he's comfortable with, because rarely do you have an opportunity to have a CEO, multi-million-dollar company, running guy here with us on, on a private, I would say, right now it's a private, private conversation. This is truly a unique opportunity. I know the amount of work we have with our MBE class, so it's an extra thank you because he had to prepare for this and that it's just a lot of work and I'm beyond grateful just as me, an individual, and also on behalf of the organization. We're super, super grateful. What we're going to do is we're going to go around the room because I think it's really nice if you know who the med students are. And then our moderator is Shirley. She'll introduce herself last. And after she introduces herself, she'll introduce you to the audience. So why don't we go ahead and start? I'm going to start with Chris because that's who I see on my screen first. So you guys just say your name, your med school, what country, and so then Mr. Ford knows who you are. So over to you, Chris.
Thank you so much, Dr. Answering. Good evening from Egypt, everyone. My name is Chris Garangbol. I'm a fifth year medical student at Suez University, Egypt. I'm a South Sudanese, the 2025 Forward Scholar representing North Africa. I'm interested in gastroenterology and specifically hepatology, and I'm also interested in infectious diseases. Thank you so much. I will throw it to Esther. Esther, thank you.
Your mic is muted. Can you unmute your mic, Esther?
Yeah, hi everyone.
Hi.
Yeah, Opio Anthony. I'm from South Sudan. I'm a student at Helwan University, Faculty of Medicine in Cairo, Egypt. I am interested in pediatric and I would like to know more about entrepreneurship. I will popcorn to Frank.
Let's see. Frank may have dropped off. Darlene, you want to go? Because Frank, I think, may have dropped off.
Hello everyone. I am Darlene Nyakara Omoyo. I'm a fifth year medical student at Egerton University in Kenya. I'm interested in plastics, reconstructive and aesthetic surgery, and we're really glad to have you today.
Patricia, you want to go next?
Sure. Hi everyone, my name is Patricia Wanjiro. I am a sixth year medical student from Kenya and a POHER 2025 scholar. My clinical interests are in psychiatry and neurology. Super excited to be here today. I'd like to call on Teddy to go next.
Hello everyone, I'm Teddy Mukuka from Zambia, fifth year medical student from the Copperbelt University. My clinical interests are in infectious diseases and internal medicine. Over to you, King.
Hi everyone, my name is King Willa from Zambia. I am a fifth year medical student from the Copperbelt University, and my clinical interest is neurosurgery. And I'll popcorn it to Shirley. Has Shirley spoken?
No, but Shirley will go last, so we can go to Korede.
Okay.
Hello
Korede.
everyone, good evening from Nigeria. My name is Korede Adekoye and I'm a fifth year medical student from Bowen University in Nigeria. I'm also a 2025 POHER Scholar, West Africa representative, and it's very nice to be here and to meet you all. Thanks very much.
All right. Frank, you want to go next?
Hello everyone, and good evening. I'm Frank Abawe, CPA out of 7 medical students from Cameroon University of Boya, and my clinical interest is cardiothoracic surgery, and it's really a pleasure to be here with you all.
Perfect. I will read Olayinka's because she's not able to unmute, and then I'll add things over to Shirley. So Olayinka is a fifth year medical student at the University of Ilorin in Nigeria, and she's also a 2025 POHER Scholar representing West Africa. And to our moderator, over to you, Shirley.
Hi, everyone. My name is Shirley Dadson, and I'm a fourth year medical student in the University of Ghana Medical School. I'm also a 2025 POHER Scholar, and I'll be your moderator for today. So it is my absolute pleasure to introduce our distinguished speaker today, Douglas William Ford, who is a visionary entrepreneur and innovator known for his work in AI-powered healthcare management. As the co-founder and CEO of Chromie Health, Douglas has pioneered the use of artificial intelligence to optimize patient care, improve efficiency in medical institutions, and transform healthcare operations. His journey into entrepreneurship was driven by a personal health crisis that exposed inefficiencies in the healthcare system, inspiring him to develop solutions that enhanced medical service delivery. Douglas holds degrees in business, engineering, and bioethics from prestigious institutions, including Cornell University, the University of Pennsylvania, and Harvard Medical School. Recognized for his contributions to healthcare innovation, he was featured in Forbes 30 Under 30 list for his groundbreaking work in AI-driven patient management. Douglas, we are excited to have you here. The stage is yours.
What an introduction. I mean, wow, visionary pioneer. That's amazing. Thank you so much. Now, I have to admit, I rarely do speaking engagements. I would love to, but there's just no time. Time is the most valuable resource, and that's what I'm going to hit home in the presentation today. But as soon as I saw Akwi's message and POHER, I said, absolutely, 100%, I have to. I went to Africa for the first time last year and loved it. It honestly ruined every other place for me. So that's why I said I have to give back in any way I can. I had such an amazing experience. I went to Kenya. And so this is just truly an honor. I mean, I really can't thank you all enough. So I figured, let's just jump right in. Let me see if I can share my screen. I got a little presentation for you all. Let's Okay. How does that look? Can everyone see it? Does it look good?
It is. Yep, there we go. Perfect. It's perfect.
Perfect. Like I said, I don't do many speaking engagements, so you have to bear with me a little bit. So my goal for today is number one, to highlight the relevance of entrepreneurship, especially in medicine. It's becoming more and more important as the day goes on. The second is to demonstrate that anybody in today's day and age can launch a billion-dollar business. And third, and most importantly, is to entertain you guys. I mean, when I heard you were medical students, I said, these poor medical students are overworked, tired, and exhausted. The last thing they need is a boring presentation from some tech entrepreneur nerd from New York. So I said, I'm going to make it so interesting. We'll laugh, we'll cry, we'll have a good time. Okay? So, introduction again. Co-founder and CEO of Chromie Health. Chromie Health is the world's largest AI-powered healthcare scheduling platform built to end the nursing labor shortage crisis. Just a few months ago, I won Forbes 30 Under 30 for healthcare, one of the most competitive categories for Forbes 30 Under 30. I have degrees from Harvard, University of Pennsylvania, Cornell, and I've been working in startups and healthcare and AI, from software engineering positions and internships to product management roles for the last 10 years. So this is all great. This is fantastic. Again, what an amazing introduction. It looks like it comes easy, entrepreneurship. It's not. Brace yourselves. This was me a year ago. I want to make sure everyone can see this beautiful picture of me. So just a year ago, I was at grad school. I had my hands in so many different projects, as is the case as a grad student, right? We have student clubs. We have, internships, research, publications. There's so much. And it's very easy to overwork yourself and lose sight of what's important in life, like family, friends, everything. So it was a very strange experience. I had been so healthy all my entire life. And then one day, while I was overworked around finals, I woke up. I said, oh, I have a cold. That's weird. And then within an hour, it just got worse and worse. It felt like I knew something was going wrong in my body. I never had this experience before in my life. It felt like everything was screaming red alert, red alert. So I said, I think I need to go to the emergency room. I don't know what's wrong, but something's telling me go to the emergency room. Hop in my car. I get a flat tire on the way to the emergency room. Luckily, about 10 seconds, I didn't even park in a parking spot. I said, tow the thing. I don't care. So I run in the emergency room, and it looked like a war zone. Mind you, I'm in a small rural town visiting my family in New Jersey. So it was a great hospital, but it was just people waiting all over the place, people running around. I said, well, I guess I'm never getting seen. And sure enough, that was true. It was a 9-hour wait just to even get to be seen. And it got worse and worse. It felt like an elephant was stepping on my chest. Long story short, I had episodes of VTach. It was myocarditis. So I had episodes of VTach. I code blued all in the span of this short amount of time. And my condition worsened because there was just no nurses available. They were extremely understaffed. So while I was there, my condition again worsened, and they had to transfer me to the University of Pennsylvania, which is about a 30-minute drive just to get to the ICU because there was no nurses. They're like, we got to get this guy out of here. And it was the most traumatic experience I've ever experienced in my entire life. Just sitting there in the hospital bed with all the doctors rushing towards me, and all the students and residents, and my mom on the other side of the glass. And I'm thinking, is this how I'm going to die? I mean, this is so crazy. I've never been sick a day in my life. And then, I said, well, this is one way to go. So they transferred me to the ICU, and it was even worse than the actual myocarditis episode itself, because it was going from all this chaos to just nothing, radio silence in the ICU. Okay, you're going to wait there for, we don't know how long, days, weeks, just until you get better. So as if that wasn't worse, because I was thinking, how could this possibly get worse? My grandfather died of Alzheimer's. My stepmom died of breast cancer. My childhood dog died in 24 hours. I've never had anybody in my family die in my entire life. So the grieving process was new to me. And then, as if that couldn't get any worse, I said, no, seriously, God, how could this get any worse? I got cheated on, and I don't even know where my car is. I'm like, I have no idea. I didn't even park in a parking spot. So I have no idea where my car is. Got cheated on. Grandfather's dead. Stepmom's dead. I'm sick. Near-death experience. I'm like, well, this is great. So then I'm sitting there for 2 weeks, and it really was like a prison, just thinking, how did this go wrong? What happened? Fully trying to grasp everything, dealing with grief in an ICU bed. And so, as if that wasn't worse, after I left, was put on severe restrictions. No exercise, daily medications. I had to take beta blockers for a year. I was severely depressed. I gained 100 pounds. I was $28,000 in debt, consumer debt. That's not including all these student loans from all these great schools. It was awful. It was terrible. So I kept thinking, okay, this is a sign. I mean, I was looking for something in life to really, propel my next venture, because I knew I wanted to do something in entrepreneurship, but it's really hard to figure out, where do we go from here? Where does the idea for a $1 billion business come from? I had probably tried, I'd say at least 20 different things. They just didn't take off. Some of the dumbest ideas ever to some ideas that maybe the market wasn't just ready for yet. So then I said, okay, let's see. Again, how did I go in 1 year? I mean, this is wild to think what a journey it's been in such a short amount of time. And if there's one thing I really want to hit home, is that in today's day and age, you have to move fast. You have to be prepared for whatever life throws at you, whether it's personal, trauma, like going to the ICU and having 3 members of your family die in 24 hours. Or, it's just, hey, this business that you just said, let's see if it works, is exploding, which, Chromie Health has really exploded in the last, 6 months since we've launched. But I'm here to share with you guys, how to succeed in entrepreneurship. Whether you're interested in entrepreneurship, it's everywhere in life, from nonprofits to launching a tech startup to even teaching. There's that element of entrepreneurship that, like we said, they just don't teach in not just medical school, but honestly, even my undergraduate experience from Cornell business, we really never learned how to actually very simply succeed in business. They teach you all the theoretical stuff, the accounting, the finance, the mergers, acquisitions. Okay, what does that all mean? So I'm here to share with you guys, this is how it really is the best method to move forward in business. And number one with everything is to start with a problem. What greater problem than being sent to the ICU and getting delayed care from a nursing shortage? So a lot of times people will come to me and they'll say, oh, I really want to start a business. I'm like, oh my God, that's great. That's fantastic. That's amazing. I want to start a fashion line. Okay, well, what problem does that solve? So if you can see on the top right, the number one business that most people start is a fashion line, and they sell black t-shirts with a word written in it, like CrossFit or proud or strength. And it's like, okay, what problem does that really solve? Great t-shirt, but the answer is nothing. So you really want to focus on the problem and sell the solution. The bigger the problem, the better. Because venture capitalists and investors are looking for big problems that aren't going to get solved anytime soon, like the nursing labor shortage crisis. So again, do you want to start a business like a t-shirt company that's just going to go, defunct in, a couple months? Or do you want to start Amazon that's really solving the problem of shipping and logistics and not having a central marketplace to go get toothpaste delivered to your house in 24 hours? It sounds so simple, but it really is a core problem that they're addressing. So again, my problem. So when I was in the ICU, I don't know if it was ego or what it was, but I said, I need to fix this. I don't want this happening to anybody else because this is such a truly traumatic experience that changed the trajectory of my life forever. So I started talking with the nurses and really understanding like what happened, because it all just happened like that seamlessly. I mean, I was driving to the ICU and the next thing you know, I'm code blued and I'm, sick and everyone's dying. So they were very, transparent with me. They said, honestly, I think what the problem was there was that nurses are either understaffed or overstaffed. Hospitals just guess demand. It's crazy to think about it, but even some hospitals in the rural United States and elsewhere in the country, they use pen and paper timekeeping methods still, which is wild to think that in the United States, where healthcare is so expensive and there's so much money going around, you're using pen and paper. I mean, that's wild. So they guess demand. So they'll say, okay, Saturday night might be a busy night, Friday night, maybe a little bit more busy. Let's have more nurses there. And then it turns out nobody comes in on Friday. So you have, 10 nursing teams just sitting there while, Tuesday night, where you didn't think no one was going to come in, is just an influx of people. So this is where my startup, Chromie Health, comes in. So Chromie Health is solving the nursing labor shortage crisis. So we provide workforce management solutions, leveraging AI to create nursing schedules. We just launched in August 2024, and already we've been deployed in 120 nursing teams worldwide. We secured $2.1 million in seed funding. We've got support from amazing investors and celebrities. We have a 100% satisfaction rating from all of our customers, which is the most important metric. And right now we're growing our team. We're, exploring future technologies like quantum computing. And, I think at the core of it, why it's such a great startup is because we're solving a big problem. We save hospitals millions of dollars per year in staffing costs. We save nursing managers 10 to 15 hours per week, whereas they used to have to, get the pen and paper out, try and balance their schedules. Now with Chromie Health, they just click one button and it creates the perfect nursing schedule based on a lot of data and history to really just simplify the process. And more importantly, we save lives, because anytime there's a nursing shortage crisis, there's a 7% increase in the mortality rate. Overworked nurses are 3 times more likely to make mistakes. So at the end of the day, whether we're having a bad day at Chromie Health or whatever, I tell my team, listen, we're saving lives here. So move fast and save lives. That's it. And it's been going great so far. Now, innovation and entrepreneurship in healthcare. As I mentioned, even if you're not interested in startups or tech, entrepreneurship is the future. I mean, you have to be an entrepreneur nowadays just to manage your own social media profile. And that's if it's just friends and family on there. So, you really have to think on your feet and understand problems and solutions in really any industry. And I'll be honest, healthcare innovation is hard. It's one of the hardest industries, but it's necessary. And there's a lot of pros that offset the cons to innovation in healthcare. So for example, some of the cons are the United States healthcare industry is very slow to adopt innovation. So big major hospitals like Penn Medicine, Mass Gen, I mean, you got to go through 50 different people just to get the sign off to even adopt your, solution, which is wild to think. However, a solution to that problem is start small. So whether you're doing something like Chromie Health or a tech startup in healthcare, start with your easiest customers first. I know it may be tempting to go try and sign on, Penn Medicine, but they have 30,000 employees. It's wild. That is a big, challenge to really start with. So start small, because there are a lot of hospitals and clinics all over the world in more rural areas that do need the help and do need the solutions that you can provide. So Another one is navigating the health regulations. So in the United States and elsewhere, there's a lot of healthcare regulations, which are good so that you don't have people who don't know what they're doing messing up healthcare. But it does put a roadblock for innovative solutions that can help save money and save lives for these hospitals. And I would really recommend, to combat this, doing your research, really doing your research. So before I had the idea for what was Chromie Health now, I really said, okay, I want to do it all. I want to take on Epic. I wanted to be the biggest, next, baddest thing in the world. That's great. Keep that mentality. Then simplify, simplify, simplify. Really, what's doing well on Wall Street and in the startup space now are startups that are extremely simple, extremely niche, so that they can really focus on that specific problem. Even in tech now with Amazon and Google and Microsoft, there's this common problem that started post-pandemic that no one's really talking about. And that's that they're trying to do everything. These big tech companies, they're buying up all these startups, healthcare startups, tech startups, AI startups. And they're running into this issue where it's difficult to manage all these products they're selling. And so they're having this problem where they're trying to boil the ocean, and it's not really working. That's great for us and people who are interested in startups, because we could come in there, sell a very niche solution like Chromie Health solving the nursing labor shortage. At the end of the day, we just create nursing schedules. But I mean, really, there's a lot in the back end. But still, it's a very simple product. And oftentimes during customer demos or investor meetings, I often hear, oh, so you're really niche, or oh, that's all you do. Yes. And guess what? It works, which is why I just knew we caught lightning in a bottle. It just really works because this is what the customers want. This is what the market wants. This is what investors want, something simplified. So I would say solve big problems, but make your solutions very simple, very niche, very easy to use. Another challenge is raising capital as a first-time founder. With any startup, that's your biggest challenge, is raising capital, investor funding, and whatnot. However, it's very easy for healthcare startups to get funding. It's very difficult for them to get customers. Honestly, I'd rather have it that way than say, you're trying to start the new Tinder or DoorDash or Uber. That's great because it's easy to get customers. You could get, 10,000 people to sign up for your next big Tinder app. It's very hard to get investor funding. And it's even harder to get those 10,000 customers to pay you for this product when there's already so many established other players. So long story short, healthcare is a great industry for startups. It's fantastic, easy to get funding, difficult to get customers, but as long as you know how to, work the system, you'll be fine. It really is quite simple. The biggest piece of advice I could give any aspiring entrepreneur, any person who's going to have even some semblance of entrepreneurship in their life, whether that's, you're a physician and you want to do research or run a nonprofit, move fast. If I could turn back time like Cher, I would tell myself, go in 10 times speed, fast forward, fast forward, fast forward, because every second you're not moving fast, somebody out there is stealing your idea and stealing your customers, and you're not going to win those customers over. So it's very important. It's crucial. If there's one thing I could distill upon everybody in this call right now, it's move fast. And then when you think you're moving fast enough, move 10 times faster than that. That's the key. Move fast. Now, on that note, another problem that I see aspiring entrepreneurs and people say is, I have this idea for a startup, Doug. Can you help me? I say, absolutely, of course. And I give them all this great advice. Yada, yada. They say, okay, perfect. They'll come back to me on LinkedIn or text me 3 to 6 months later saying, Doug, how do you like our logo? And I said, you spent 6 months on a logo? It doesn't even look that good. No offense. But you really need to move so much faster than that. So what I recommend is from the moment you have an idea to when you say, that's it, I'm ready, I'm committed, this is it, spend 6 weeks building the product. And that includes the website, writing the business plan, everything ready to go, 6 weeks. So in startups, the number one most common phrase you're going to hear is your MVP. When I was starting my business, I was like, what? They never taught this at Cornell or Penn. What is an MVP? It stands for minimum viable product. And what that means is your first draft of your product, however horrible it is, it does not matter. If it's such a necessary solution or startup that the market wants it so bad, they will pay for it no matter what. I can assure you. So on the left, you see this telephone pole that's duct taped. That is what Chromie Health looked like in August. I was like, this is so terrible. Oh my God, this is so embarrassing. All the investors were like, no, this is great. This is fantastic. I myself am a bit of a perfectionist, something I'm working on. So I was like, no, I need to get better. I need to get better. Throw it out there. And every single demo we were doing, people were saying, yes, please, how early can you implement this? We need this. We need this solution. So I said, all right, that's a good sign. And so shortly after, I mean, as early as, a month or two after launching, your product will eventually look like that nice telephone pole on the right. But if you spend, 6 months building a product that the market doesn't really want, that nobody's that interested in, that's a lot of time wasted that you could be using to build another startup, to build your next solution. Like I said, Chromie has been tremendously successful. It did not come easy. It was, I'm not even kidding, probably 30 different startups before this one that just completely failed. But what was the success was that I moved quickly with them. So I was able to see. It's like just throwing a bunch of things at the wall and seeing what works. Because ultimately, at the end of the day, it's up to the market to decide if they want your solution, if they really need it, and if they're willing to pay for it. And there's only one way to find out if the market wants it: move fast. So this is a diagram that I really love to show to see if people are interested in entrepreneurship. And it is so true. I mean, your day is going to be up and down, up and down. You're like a firefighter, just constantly putting out fires. So you'll be excited, and then the worst day ever. This is so hard. Then, oh my God, this is amazing. I messed up. So it's just up and down, up and down. And again, the way to combat that is to move fast. Another thing, the second most important tip I have to share is to communicate fast. Not only do you need to move fast in operations, but communicate fast. So whenever someone sends you a message, customer, investors, you need to respond right away. I don't care if you're skydiving, if you're rock climbing, right away, because people, especially customers, they get disinterested quick. They want an answer right now. In today's day and age, everything moves so quickly. So you have to adapt and move quickly as well. I show this picture of Harry Potter because this is exactly what I attribute a lot of our success to, is just sending out cold calls like Harry Potter. That's how we got on Forbes 30 Under 30, just mass sending out emails. Hey, I'm really interested in a nomination for Forbes 30 Under 30. Do I have your support? It's like being a politician, whether you're selling a tech startup, getting investor funding, getting on Forbes, you really just have to Harry Potter that stuff. Send so many messages out, because really, even if you get 3% back, that's, pretty good, So you really just have to communicate fast. So, like I said, Forbes 30 Under 30. I really do attribute moving quickly to being on Forbes 30 Under 30. So why I was recognized was my story, was the solution. And I really realized quickly that whether you're pitching to customers, you're pitching to, let's say, your physician medical students, you're pitching to a nonprofit, a publication, an op-ed request, you really want to think about your story and kind of make it a nice little compact story to sell. So I told the story of, I was in the ICU. This was a traumatic time in my life, but I realized, let me make sure this does not happen to anybody else. And let me launch a tech startup that's solving the nursing labor shortage crisis. So I'll be completely transparent. I like you guys. Forbes 30 Under 30 was an amazing opportunity. The New York Times just said that it was the Oscars for corporate Gen Z America. I said, no truer words have ever been said. It opened so many doors for me. And, I think what I could give for advice is everybody has that special little something, whether you're a doctor or you're coming from, Africa, whether you're, you went to these amazing schools, or you have this skill, you can speak multiple languages, that's very useful. learn how to pitch that and sell that to customers, to investors, and weave it into your story, because people want to buy a story. They want to buy something that, you know, is very inspiring and motivating at the end of the day. Now, bioethics. My program, the bioethics program at Harvard, has been fantastic. It's been amazing. I'm so lucky. I wake up every day and I just love going to class because I'm surrounded by such a diverse group of intelligent students from all walks of life. And it really does challenge me, you know, every day to really contribute and to just put my best foot forward, not only in the program, but also for the startup. So I would really encourage everybody to continue their education if they're interested in that, because there's so many options for remote work, for remote learning. There's certificate courses. There's masterclass.com. There's so many options. You want to be a sponge and keep learning as much as you can. So this degree has really helped me with an interdisciplinary learning, because it's taught me the legal aspects of healthcare. It's taught me the technical aspects. It's taught me the research, the writing. So it's really been an invaluable experience. So I can't recommend studying bioethics, especially for physicians, enough. So goal setting, that's another important part that is a challenge for first-time entrepreneurs. But really what you want to do is you want to align your passion with your career, because at the end of the day, if you're not liking what you're doing, you're not going to succeed at all. So you really want to like what you do. And if you don't like what you do, find something about your career or this assignment or this project that you like and hyper focus on that. And the most important thing too is the best time to start your entrepreneurial journey is, drum roll please, now. Now is the perfect time to start your entrepreneurial journey. Even if you don't want to, you know, make this your full-time career, start something on the side. You know, start like a nonprofit, start a journal publication, start something. And if you can't start now, the second best time to start your entrepreneurial journey is now. But I understand that might be a little challenge for some people. So if you can't start your entrepreneurial journey now, start it now. I can't reiterate this enough. I really can't. You know, it's never been easier in the course of human history to launch a billion-dollar business. It really hasn't. Not only do we have the internet, cell phones, and social media, something they didn't even have, you know, 30, 40, 50 years ago, but now in the last few years, we have no-code tools, which are tools that you do not need to, you know, be a little programming nerd like me to really leverage. There's Webflow. Write these down. Webflow, Bubble, the two greatest human inventions, I swear. Webflow is a website that helps you build websites. So again, you're going to need a website, whether it's, you know, for a nonprofit, a journal. Webflow is key. If you want to build an app or a startup, Bubble is amazing. That's the go-to. That's what everybody uses. And then there's also YouTube to help teach you how to use these no-code tools. And then if you're like, you know what? I don't like none of this coding. I hate it. I don't like any of this technical work. Fiverr is an amazing resource. You can outsource the development of your website, of your business plan, of your presentation for as little as $20. I love it. It's amazing. And then the greatest invention, surely, forget Webflow, forget Bubble, ChatGPT. I love it so much. It is my therapist. It's my chief of staff. It's my mentor. It's my Yoda, my little Obi-Wan Kenobi, all in a little website. It's helped me so much to launch my business. Whenever I have questions, we're like, does this sound good? Throw it in there, you know, just throw it in there. But please don't use it for school. That's very bad. And I never have, never would. I'm very, you know, concerned about that. So just really stick to using it for every other facet of your life. Let it be your therapist. And then another thing is, in today's day and age, what nobody's really talking about that caught me by surprise is there are now 1,000 investors eager to invest and throw money at you for every startup. You can easily get funding, especially in healthcare. And these investors are not like the investors of, you know, 2010, the Uber age, the DoorDash age, where they would make you eat ramen noodles and pay yourself a $30,000 a year salary in New York City or San Francisco. They really are fantastic. Fantastic. Our investors have helped us so much. They're there to support you, and it's really just a great teamwork. They're another, section of your team to really help you and give you a lot of money. So let's conclude with the future of healthcare and technology. So I firmly believe that AI and quantum computing are the future of healthcare, particularly AI, because it's here right now. It is the future. I know whenever there's a big emerging technology, people are a little bit hesitant. I don't know. They did that with the internet. Go look up Bill Gates on David Letterman in 97. David Letterman was like, this internet thing is never going to take off. Have you heard of radio? Radio's so much better. That aged well. So another thing is there's so many opportunities in global healthcare innovation. Healthcare is also the future because, it's just more and more necessary. People are, population's getting older, people are getting sicker, they're living longer. And because healthcare is so slow to adopt innovation, it's really crucial that people are there to really put their best foot forward and help welcome innovation to the world of healthcare. And then finally, I'll conclude with I love Africa. I really do. I rarely give speaking engagements. I get like 4 hours of sleep a night and I just don't have time. But as soon as I saw this, not only because I love Akwi, she's the greatest student in the program, but because I truly do love Africa, I'm dying to go back there. I read up on African news all the time, and I truly do believe it is the future. I mean, it's the fastest growing population in the world. By 2050, 1 in 4 people on Earth will be African. Africa is also leapfrogging traditional systems like landlines and going straight to mobile phones. So I think they'll do that with healthcare. I truly do, especially in the coming years. I think with, hospital models and AI, they won't be as, I hate to say it, foolish as the United States. In some regards, very slow to adopt innovation. When there's people that are sick and dying and this can help you, it's just very slow, very corporate in many cases in the US. I don't think Africa will have that issue. Africa is very smart to adopt innovation, and they're very open-minded to all these exciting new technologies. There's so many new cities that are just exploding with AI innovation. And with that being said, my final tips for advice, in case you were sleeping, don't worry, I get it. I'm not that exciting. But here are the 5 tips for success. If you're going to leave with anything, I just implore you, please write these down, screenshot, get your phone out. Number 1, move fast. I can't reiterate that enough. Number 2, try and fail fast. Meaning, try everything, just throw everything at the wall, put yourself out there, don't be afraid, because you're never going to blow up and have such great success on your first go around. Like I said, Chromie was my 30th startup, if you consider like a lemonade stand when I was a kid at number 1. But you really just need to get yourself out there, try and fail fast, and love failure. Embrace failure. It's such a great learning experience. Number 3, communicate fast. Always respond quickly to messages, to investors. I've been fortunate. I've met a lot of billionaires in my life, millionaires in my life, people who are extremely successful. The number one thing that I always notice is when I message them, whether it's on LinkedIn or text or email, they respond before I even put my phone down. It's a very common thread that not a lot of people talk about. So always respond quickly. And it doesn't need to be a long message, just short and sweet to the point. Number 4, have fun and stay positive. I'm not gonna lie, I love what I do. I wake up every day, even though I'm exhausted, and say, this is the best life I live compared to just a year ago. I have an amazing team at Chromie Health. I'm loving what I'm doing. I'm loving the customers. I'm loving the investors. It's just an amazing experience. A lot of work, but even when it's challenging and I'm surrounded by fires that I'm trying to put out with a water gun, I say, this is great. This is so much fun. I love this. So with that being said, if you forget steps 1 through 4, if there's one thing you need to take home, it's number 1, move fast. I can't reiterate that enough. 6 weeks. If you have an idea for a startup, I'm going to give you 6 weeks to build it. And then when you build it, message me on LinkedIn, email me. I love connecting with people. We're fully remote. I live like Rapunzel in a little apartment, just looking out the window, wishing I could, go talk to people. So I love talking to people, love connecting, and I love making new friends. So move fast, and I'm excited to see what everybody builds. So with that being said, I would love to turn it to you guys for questions.
Wow, thank you so much for this wonderful presentation. Right now, I'm motivated to move fast, communicate fast, and start my entrepreneurial journey right now. So we are yet to start, we're about to start the question and answer session. I will start by asking you, how do you stay ahead of trends and evolving market demands?
That's such a great question. I've actually never been asked that before. So I would say definitely, again, start with the problem. So another mistake that I see a lot of young entrepreneurs make is that they're focused on the solution and not the problem. So for example, in the past few years post-COVID, I mean, how many tech trends have we had? I can't even keep up myself. Cryptocurrency, Bitcoin, the metaverse, blockchain, cloud computing, big data. I'm like, what? They're great, but what are they solving? What does cryptocurrency really solve? That's a topic for a later discussion. But really focus on the problem and then also just read, research, digest as many blog posts, LinkedIn posts, YouTube, Reddit, and just always be ahead of the next big thing and never think that something's not going to take off because I swear I was said Bitcoin's never going to take off. That's crazy. When I heard about it in 2013, that's the dumbest thing ever. And that was when it was trading at like $200 and now it's like $100,000. So be open-minded, start with the problem and just research the next big thing.
Thank you so much. We have a couple of questions in the Q&A. So I'll read the first one and we'll pick someone in the participants with their hands up to ask a question. So the first question is, can you elaborate more about cultural change in less developed countries, especially regarding adopting new technology and new working morals?
Oh, another great question. You guys are so good. I love it. So I have to say, that's really important. One thing that I noticed is that every country has a completely different, unique culture. Every city has a completely different and unique culture, not just in the United States, but truly all over the world. So you really have to understand that culture by moving fast and really just being open-minded. So for example, a lot of investors are solely focused on the United States, but there's even more investors that are open to, all of the new countries that are developing amazing solutions. And so we did the same thing. We started recently pitching to, Canada, Israel, London, all these different countries. And I'm shocked at just how completely different the culture is with every country. I mean, in every company, the culture is completely different. So the way to address that is to just really be open-minded and move fast to really just understand, all that's out there and to get firsthand experience on the different cultures.
Okay, thank you very much. Frank, you have your hand up. Can you go ahead and ask your question?
Thank you very much, Sarah. Thank you very much, Mr. Douglas Ford, and it's really an exciting presentation. As you said, we should really move fast in everything we want to be, especially entrepreneur journey. But I want you to maybe enlighten us based on your experience, because I'll take an example in my country where we have a lot of infrastructural challenges when it comes to launching maybe health and technology startups. For example, like attending this Zoom session, internet connection has gone up like 2 times, electricity has gone up like 2 times already. So how can we maybe leverage the current technology that we have, though we have some of these structural challenges like electricity, infrastructure, and internet connectivity? How can we actually leverage this technology to be able to innovate and bring out some positive change in our communities?
Yeah, it's a great question. So one thing I've also realized is that everybody, no matter where you're from, what country you're from, what language you speak, everybody has a unique skill set and everybody has a unique story. That's one thing that my grandfather told me that, I'll always remember is that everybody has a story. Be a listener. Don't just, blah, 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 blah. This is why it's so like out of my comfort zone to, just talk for 30 minutes straight is because I really do feel like one thing that makes me successful is being a listener. So listen to other people's stories and then also, learn how to, sell your own story. So leverage your strengths, even if it's something as so small as, listen, I, can make really good coffee. I don't know. learn how to launch like a YouTube channel that can teach people how to, make better coffee at home. I'm just thinking off the top of my head. And then from that, you could build up, a community of coffee lovers to then launch your own coffee business. And then who knows, 10 years from then, you could, take on Starbucks. So really, focus on your own personal strengths and ignore the rest. Really, you just have to have that go-getter mindset. Ignore the cons and just focus on the pros and learn how to leverage your own skills.
Okay, so the next question in the Q&A is, I noticed a big problem in the healthcare market in my home country. How do you break it down to simpler, actionable startups?
Great question. So this is what we did. Again, everybody starts with this big, brilliant idea. That's good. That's fantastic. In my case, it was I wanted to make the next big epic because I want to simplify epic. That's great. Then you have to really just go simple and simple and simple. Even if it's just theoretical, start with your idea and say, how can I make this so simple I can launch it in 6 weeks? That's what you need to focus on. 6 weeks. How can I get this in front of a customer and with a straight face say, I want to charge you X amount of dollars for this product? And so to do that, I really just focused in on getting my hands dirty, really building, getting on Webflow to build that website, getting on Bubble and teaching myself how to build an app and really just simplify. Rather than, daydreaming or writing on pen and paper, this is what I'd like to do. That's great. That's called journaling. That's not business. So you really need to, just get your hands dirty and say 6 weeks, starting today, 6 weeks, I need to be in front of customers. What can I sell them? And then you will quickly realize it will just spiral like an avalanche into a bigger, larger product that you were at the time daydreaming of. 6 weeks.
Okay, Ken, you can go ahead and ask the question.
Thank you, Shirley, and thank you, Mr. Ford, for this mind-blowing presentation. I mean, I loved it from the start to the end. You emphasize much on moving fast, but when you come to for entrepreneurs who are not technical, like who do not know how to code, how to write a program, and then they have to like outsource those expertise. How do you advise them to move fast? Because I mean, they're moving fast is dependent on the technical co-founder they are working with, and if that person is slow in moving, meaning even their moving will be very slow. What would you advise such an entrepreneur?
Great question. So I would definitely advise them to first learn as much as you can. Again, there's never been a better time for entrepreneurs. I think we as humans are so hard on ourselves, especially as the time goes on. Oh, we can't do this. I'm not qualified. And I really think it's because of social media and, scrolling through Instagram. We're seeing people, flying private jets, bikinis, It's like, okay, anybody is capable enough to launch a business. There's no requirement. It's not like, 200, 300 years ago. So you really need to, in that regard, just believe in yourself. It sounds so corny and tacky, but it's so true. Say, you know what? I am going to start the next $1 billion business. I am going to do it. None of this, I'm not technical. I can't do this, because I did have that mindset myself. But then once I realized, wait a second, I don't need to actually code like they're teaching in school or like how people think you need to code nowadays. With no code tools, with YouTube, with Fiverr, it's never been easier to launch a business. There's no more need for really technical, coding skills. And then also, I would say the hardest part of any entrepreneur's journey is the first 3 months. I promise you that. Once you get enough funding, you outsource all the technical aspects. So you really don't need to, learn how to be the next big coder or the next big engineer. You will eventually hire the engineers. So that's why the key is to just move fast, get that telephone pole duct tape up and in front of customers in 6 weeks, and the rest will come easy.
Great. The next question is, Some funding applications rely on empirical data to ascertain the worth or effectiveness of the app, though. How do you suggest to justify the idea in proposal applications then?
Yes, this is the big one. So I would say if you even have one customer, that will make you 10 times more likely to get funding. So really, price that sucker low or do what they're now calling pilot programs in healthcare, which is completely free. Say, hey, listen, it's completely free. And for this case, it would definitely need to be something not touching patient data, something more safer, like, scheduling something. But pilot programs are very helpful if you can't get anybody to pay. And then the third option, which is a new feature in, tech startups, is a wait list, which is also very helpful. Launch a nice fancy website, create like a little short video. This is what we're going to look like. Here's our wait list. And then on the website, just have a wait list. If you take that list to an investor, even if you just got like 10, 20 people to sign up, but you could get a few hundred if you really do a good wait list and blast it on social media and, have friends sign up. Who cares? Investors are so eager to invest, especially in healthcare these days. It's a lot easier to get money. I mean, especially in New York City, they are just the money is in the air. You can smell it on Wall Street now. They're throwing money at some of the dumbest ideas I've ever heard. Great for us. So I would say, really just waitlist is the easiest method. And pilot programs. And then also, even if you just get one customer, you'd be surprised. You'd be surprised how many investors want to invest.
Okay. Patricia, you can go ahead and ask a question.
Thank you very much for the opportunity, and thank you to Mr. Douglas Ford for the wonderful talk. I'd like to ask a question maybe for the entrepreneurs who are looking to start a non-profit or a mission-driven organization. Are there any practical strategies that you'd recommend for such ideas to generate revenue and to ensure financial stability without compromising the values or the mission of the business?
Great question. I have such a special place in my heart for nonprofits. I really do love nonprofits. I've been surrounded by them. I love volunteering my entire life. So I would say a big challenge is what you mentioned, financial stability, if you really want to work in a nonprofit. So a lot of nonprofits work on grants and donations. So I think the best method to have that financial stability is grow your network as best you can. LinkedIn is an amazing resource. Reach out to the wealthy philanthropists and say, hey, look, this is our website. This is what we do. This is our mission. And also try and build a network of people who have personal experience with that. I'd be much more likely to invest or donate to a nonprofit that's helping, cardiovascular research, giving my heart condition or, something in the nursing labor shortage, just given my interests. So I would say definitely build a network of people that you can reach out to. And also grants. I mean, there's, again, similar to investors, there's so many philanthropic organizations, rich, wealthy philanthropists that have money that are just willing to throw it at you to really help your dreams come true. And at the end of the day, remember, even if the financial stability is the most challenging part of a nonprofit, you're saving so many lives. You're helping make the world a better place. And that's really what's key. Better than, starting a new DoorDash or Tinder app. Do we really need another one of those? No. Focus on the nonprofits.
The next question is there a difference in approach between deploying the prototype versus the first version of the app?
That's a really good, oh my gosh, you guys are giving such great questions. I would say, believe it or not, no. So the way to obtain customers doesn't change that much. So the best method to really get your first customers, whether it's, a nonprofit, whether it's a tech startup, or you're launching a rocket to, Jupiter, it's really cold calls and leveraging social media. LinkedIn is the greatest resource in the entire world. You want to know why? Because I hate social media so much, and yet I spend so much time on it because I know how important it is. I'm like I don't know, the most humble. I just think social media, it's so strange to me to like put myself out there and like, okay, take photos like I'm, Paris Hilton or something, but it works so much from every stage, whether you're just launching, you don't even have a product, or you're, Bill Gates or Tim Cook. I mean, you constantly see them out there really using social media and posting. And that's because that's the best way to get customers. Message them, cold call them, whether you're customers or investors, just message them, use social media. It's free, because the second method to really get customers is to use Google ads, which can cost tens of thousands of dollars. I mean, you can put $20 into Google ads, and it's very complicated. So make sure your LinkedIn looks good, you got a nice photo on there, and just cold call, message everybody, and build that network. You'll be surprised how easy it is to get customers and investors, truly.
Okay. Esther, you can go ahead. Esther?
Okay. Thank you so much for the great presentation. As someone who has ever set a business, and I'm actually applying to set another one, I just want to know, like, when someone sets a new business, there is a phase where you don't have customers, and you end up losing hope sometimes, and you start being pessimist about the business. I just want to know, how can someone handle that stage? How can you keep on moving on when you don't have customers?
That is another great question. It's so important to never lose hope. As an entrepreneur, hope and time are your best resources ever. So I think for me, and believe me, I lose hope by the hour. I'm like, oh my God, how is it this late? I'm losing hope. There's so much that I have to get done. I want to go, meet my friends for dinner. But, so the key for that is to just be grateful. Again, I know it sounds so corny, but it's so important. Be grateful. Be grateful that you live in an era where there's so many resources to launch this business. Be grateful, say, oh, this is fantastic. Even if your business goes nowhere, just think, I can really print this little logo out, this website, and show my kids one day, like, oh, look, this is an amazing, I launched this business, and hey, we didn't get any customers, and I lost, $500, $1,000, but it was still fun, and it was a learning experience. So realize that you can't lose hope. Everything is a learning experience, and if this business doesn't turn out, the next one will, or the next one. It's just a constant, race to see what works. And whoever doesn't lose hope are the ones who succeed. Walt Disney said, wow, that quote just escaped me. It was a good one too. That's terrible. Oh, he said, whatever, it'll come to me.
Okay, the next question is, are there investors willing to help startups in Africa?
Yes, 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 yes. Back to the point of why it's so important to really, really put yourself out there, is because there's never been a better time in human history to launch a startup. COVID threw everybody into the remote world, whether they liked it or not, because now we have team members from all over the world. You're not just limited to New York City, where bus drivers get paid $100,000. As a young startup entrepreneur, I barely have money for myself to eat. So we really embrace people from all over the world for our hiring processes, and it really is because you have such a greater access to talents now with remote learning. And not only are founders realizing that, because so many startups are fully remote now. I mean, when I got funding, I went to get a quote for a little teeny tiny office space in New York. It was like $30,000 a month for a closet. I said, oh, this is just horrible. I think I'll stay at home where, I got like the pajamas on, I'm working, I could do this, that, and the other. And that's how most people want to work. So investors know that. And then investors also know that with remote learning comes opportunities for investments in other countries. So they are constantly investing in Africa. I see it all the time, France, all these other countries. And I really can't encourage everybody enough to put themselves out there, because, like I said, I see it in the chat. It's true. I love New York. There's money just flying all over the place. So much so that people here in New York and the United States aren't even grabbing at it. People in the other parts of the world are grabbing at it, which is an amazing thing because we need to bring innovation to other countries throughout the world.
Okay. The next question is, thank you so much for sharing your journey, Douglas. You mentioned that you had a number of ideas before Chromie Health. How do you know when to move on from such ideas to avoid sinking too much resources into an idea that the market is not ready for?
Another great question. And so that's a really challenging thing because a big mistake is that people, they have this idea and they're just so passionate about it. They say, this clothing line called Doug's T-shirts that has the word CrossFit on it is going to be the next big thing. I'm going to be sitting front row New York Fashion Week with Donatella Versace. It's not going to happen. You're not really solving a good problem. And maybe it will, who knows? But it's not going to happen. So I would say, when it's time to move on, when you've exhausted all your resources, not just financial, but really, I'd say you put everything out there and you're just not getting any customers. I'm big on timing and schedules. Ironic because that's what Chromie Health does is scheduling. So it's a perfect fit. And so I say 6 weeks to build. And I'd say 3 months of just hard work and grinding, messaging everybody out there really, and just trying to do everything you can to just get your first paying customer. If you get one customer in 3 months, you're good. Keep on going. And then say, all right, let's reevaluate. And then the number one most important statistic, write this down too, is growth rate in startups. Investors, they don't care about your product. They don't care about this. They don't care about that. Unfortunately, all they care about is your growth rate. That's the number one question they're going to ask. So how quickly are you guys growing? What's your growth rate? 10% is good month over month. 20% is amazing. We're at like 28%. So we're just growing rapidly because investors look and they see that growth rate as a percentage increase on their investment. So really focus on the growth rate. Give yourself 6 weeks to build, 3 months to get your customer, and then start tracking your growth rate. And don't be afraid. Say, okay, let me put this on the back burner. Maybe it's just not the right time for this idea. And that's okay too.
Okay. The next question is, amazing presentation, Mr. Ford. My name is Given, a final year medical student, CBU Zambia. My question is, amidst so many problems today, troubleshooting that $1 million question can be crucial, but clearly never an easy task. Otherwise, we would all be millionaires by now. So is it purely trial and error till you make it, or perhaps precision troubleshoot to land that $1 million question?
That's a really good question. And it's true. And I think the sad fact of the matter is that there's so many potential millionaires out in the world, out in this call right now. But the big problem is that people just don't move quick enough. And moving quick enough allows you to do the trial and error work that's necessary. Trial and error, it is essential to a startup because you just don't know what the market wants, what customers want, what investors are looking for. So the only way to do it is just throw everything out there with your ideas, see what sticks, try and fail fast. Again, I think another reason why New York is so successful for startups and for billionaires, I mean, there's thousands of billionaires in the city, more than virtually any other city, is because we're on 10 constantly, as you can see, inhaling in the chat. It's so true. And I love it. I wake up in the morning, 5 a.m., run. I go out to get to Starbucks, but everyone's just flying by me. And I think that culture really does help startups and people succeed in life because we live in a fast day and age, unfortunately, as it is to say. Everything's just moving quickly, and you got to keep up with that. So I think that's really the key to success.
Okay. The next question is, how do you pitch your app as something worth investing in when the competition for funding is against treatment for Alzheimer's? Here is a new tool to detect brain cancer or other high-yield topics that people perceive as more important to address.
Yeah. So, well, first of all, Alzheimer's is a big problem. That's the idea you want for launching your startup. How am I going to cure Alzheimer's disease? How am I going to stop climate change? How am I going to stop, poverty in the world, famine, big problems, because investors look for big problems. They're not looking for, unfortunately, a black t-shirt with a word splashed on it. They're looking for people who are solving big problems. So I think the key for that too is to really create your story. Everybody has a story. Learn how to pitch your story and keep it short and sweet, because unfortunately, people have terrible attention spans. So they'll zone out quickly. So really learn how to sell your story and then sell your product. And for investors to get funding, like I said, they care about the growth rate. So make sure you hit that home. Make sure you say, we're growing exponentially. We're growing at, a 10% rate, 20% rate. In just 3 months, we've got 400 people on our wait list, Learn how to pitch it. Even if you don't lie, because that's terrible. We don't want to lie. But learn how to, really get passionate about it. So even if you just have I'd say, 40 people on your wait list sign up, say, hey, we've got a 80% increase in waitlist signups since last week. That's a great way to sell it, And so again, big problems and really learning how to sell your story, and for investors, growth rate. And then also for customers, focus on how much money they'll save. They love that, especially hospitals and healthcare. Unfortunately, investors and customers, they just care about the money. So growth rate for investors, how much money your solution will save for customers.
Okay, the last question is, can we have your email and LinkedIn?
Yes, absolutely. Please, I'll put it in the chat, my email and my LinkedIn. I truly do mean it. I love connecting with people. I love mentoring. I love teaching. I love making friends. So reach out to me, message me. It really makes my day. And listen, I'm here. I am an open book. So anytime you have any questions, feel free to ask. I wish somebody was more, I'd say direct in telling me what it takes to succeed, as opposed to, Cornell or Penn. Harvard's been amazing, but other, educational experience, very theoretical. So, I think mentorship's important, and I really would love to help in any way I can. So I'll put my email in the chat and my LinkedIn. So I can't thank you guys enough. This was fantastic. And I just remembered the quote from Disney. How amazing is that? What a way to end. Walt Disney said, all our dreams can come true if we have the courage to pursue them. And I want you all to remember that as the final takeaway. It's not easy making it as an entrepreneur, but it's fun, it's exciting, it's rewarding. And as long as you put yourself out there, don't be afraid to fail, you're going to do amazing. So I can't thank you all enough. This has been such a fantastic treat, truly the highlight of my week.
Thank you so much.
Oh my God, Doug. Thank you. Thank you. Thank you. Thank you, Shirley. Thank you, Doug. Like I said, like you said as well, I know obviously how busy you are. So this is a big deal for you. You took the time to put the presentation together. You took the time to share. You've taken the time to speak with us today. I know there's some people having issues logging in. For those, we're going to try, because we can live stream it, but my tech skills will try to post this so others could, truly learn from, from what we learned today. So I am just personally grateful. And on behalf of POHER, a big thank you for spending all this time with us today. We truly appreciate you. So thank you, thank you, thank you.
No, I can't thank you all enough. And like I said, I rarely do speaking engagements. I jumped at the opportunity. So hopefully I didn't disappoint. And, I really look forward to being the first customer for all of your billion-dollar businesses. And truly, Africa's the future. Don't forget it. I'm really excited to come back and meet you all. I'm dying to come back. So hopefully.
Yes, yeah, we made a note in the other chat. We're like, okay, so New York to inhale the air. We have someone there to capture the air. We're not going to take 6 months for a logo. We got 6 weeks, team. Everyone's going to come up with something. Correde is going to create a problem so that he can fix it. So the minds are moving. And one of the other scholars is like, he already felt like a millionaire just by you speaking. So
right.
we're moving in the right direction here.
I love it. It's amazing. And anytime anyone's in New York, please come and stop and say hi, truly.
Thank
I
you.
can't
Thank
thank you all.
you. Thank you so much, Doug. Really, really appreciate you. I'll stay on a few minutes because he's posted his information. If anyone wants to grab it, his LinkedIn, it's very easy to find. We've shared before, so feel free to reach out to him. So I'll stay on here for 1 more minute. So if people want to, get his email address and stuff. So Doug, thank you so much, and I'll see you in class next week. So
Definitely. Thank you all. It was so much fun. You guys are the
thank you.
best.
Thank you. Have a great day. Ciao.
You too.
Thank you, Shirley. Thank you, guys. I will slowly close this down. I'll just give it like a minute if anyone else wants to grab his information, but that was great. I'm gonna really try, we'll try to post this on, once it's done. Oh, Deborah has her hand raised. Let me see how to, let's see. Deborah, I'm just gonna look so that I can, so that you can answer the question. You can ask your question. So I'm moving some of the scholars up if anyone wants to ask a question. Go ahead, Deborah. You had a question.
Yeah, I just wanted to thank you so much for this session. It was really great. I just wanted to mention that I think he put his LinkedIn and email address in the other chat. It's not available to those of us not on the panelist
On the
chat yet.
panel. Okay, thank
Yeah.
you. Let me copy. Oh, wait. Let me see. Okay, when I click on it. Okay, I got it. I see what you're saying. So let me see. So I'll post that's his LinkedIn there. Can you see it now?
Yes, I
And
can
then
see
let
it.
me find he did type his email address on here. It's basically Douglas at Chromie, but I'll type it in so I don't make a mistake. Douglas at CHROMIE. It says Chromie Health. I feel like there's something missing there. I can ask him too. This is what I got from what he posted, but I can also ask him. I'll shoot him I'll shoot him a message and then I'll post it in the group. But unless someone else got another, unless he posted something else, but that's what I saw in the chat. But I'll ask him. I'll shoot him a message and then I'll share with you guys. Not a problem.
Thank you.
All right. Thank you guys. We'll send you an email. You still should have emails coming about meeting with you guys, and then we'll send the email about the moderators for next month. Plus, I know a few of you are planning the women's the empowerment of women and girls in STEM. So have a great day, everyone. Take good care, and thank you so much, Shirley. That was amazing. Thank you. All right, take care, guys. Ciao.
Bye, everyone. Take care.